But on the flip side, there are also a number of instances where people do know about cervical cancer. They do know that we should go for cervical cancer screening. But why are we not going? A number of reasons. One of the reasons, the biggest reasons from our experience, is that of fear. Fear, number one, of the procedure. The belief that you will be subjected to excruciating pain whilst undergoing cervical cancer screening, which is not the case, or it shouldn't be the case. So we reach out and appeal to the medical professionals, the personnel, to explain to us about the different options that are available, the different procedures, to make it less scary and to give us the clear picture and the correct picture about cervical cancer screening. Secondly, the fear of being diagnosed. Once I have been diagnosed with cancer, what next? I'm going to die. Cervical cancer in particular we're talking about. However, as you know and many people know, and the message we need to get out is cervical cancer is preventable. It is one of the cancers that you can prevent with a capital P. Not just reducing your risk, but you can actually prevent it. So that needs to come out more strongly. And also the fact that if caught early and treated, it is curable. With a capital C, it is curable. So we have to change our messaging to appeal to people using various multimedia platforms in the different languages that people understand. The third fear. Fear, I have been diagnosed, now the stigma, the shame, the isolation. Cervical cancer, as many of us know, is a sexually transmitted disease. And that is culturally not something we discuss. Sexual issues are all, or very often, hush-hush issues. We have to begin to revisit our culture in terms of the discussions we have regarding sexuality. And then also, we have seen it in many instances, the fear of being abandoned by your partner. Again, these are conversations we have to have with our men folk and using different avenues. We've got the churches, they are a very powerful force. The media, very powerful force to deal with. Traditional healers, we have to involve them in the conversation. So when we look at these areas of fear and begin to reduce these fears, we believe that will help a lot to encourage people to go for screening, to encourage the guardians to take their daughters for vaccination against cervical cancer screening, and also for the community to not to be judgmental, to reduce the stigma, the discrimination, the isolation, and the shame that very often it comes with a cancer diagnosis or cervical cancer diagnosis. We have to change the narrative about cervical cancer. In that way, this elimination strategy will gain ground, and within a generation, we will say goodbye to cervical cancer.
Thank you so much.
You're welcome.